guys, this is Justin Brock, and today I'm going to go over 5 key preparations for 100 sales in AEP. So just wanted to get some quality information to you to make sure that you guys or your agents that you're working with can have a successful AEP. 100 should be the baseline. Of course, we want to see people do 250, 300, but 100 apps in AEP is certainly a feat for a lot of people. And once they get there, it's kind of the foundation for being able to build quality agency on agents that can do that. So wanted to go over that 5 key preparations for 100 sales in AEP. And if you see me look off just a little bit, I'm just looking at my own slideshow to keep me on track. Okay. So getting into it, just want to tell you a little bit about myself. If you don't know, we own BBI, which is kind of a house of different brands, Bobby Brock Insurance, Building Better Insurance, and we operate an Insurance Gurus podcast. We also do some work on some other platforms that help agents, whether they're affiliated with us hierarchically or not. We just want to get out there and help more people, and we know if we do that, we'll be able to build. Background for me is we're coming up on a decade in the insurance industry, solely focused pretty much on Medicare Advantage, Medicare supplements the whole time. We do a lot of Medicare supplement premium. That's where I got my start, was going house to house for Medicare supplement rewrites in Northeast Mississippi. And we've built a really quality brand that brings in a ton of people who are turning 65, retiring, or just shopping their coverage, making sure they have the best thing now. And we're doing a lot of volume. But that came over time. We had to build it the way that most people have to build it. Slow and steady wins the race. So also was in the Marine Corps for 8 years before I got into the insurance industry. One of my claim to fame is I did write over 100 applications in 1 week several years ago when I was the primary or key producer in our brick and mortar office. And don't really recommend that. That is a lot of production in 1 week, but if I'm talking about writing 100 apps in AEP, clearly I know how to do it because I wrote 100 in 1 week. So let's get right into some of the meat here. So one of the things I tell people when I'm trying to get them to write more in AEP is that planning for AEP, it starts all year long, okay? It really starts January 1, even though OEP gives us a lot of opportunities to help people throughout the year. January 1, you can start filling that pipeline for AEP right away, okay? So I'm talking to people that I can't help until AEP. I'm talking to people that aren't hot until AEP, all these different things. But that's why utilizing a CRM to put these prospects in there and set follow-up activities for AEP can make sure that your pipeline is ready to explode when you get to AEP. People that start prospecting for AEP and they worry about just small lead drops in pre-AEP or August, September, they always struggle because they don't have that, exploding pipeline by the time AEP gets here. So start right away, filling your pipeline all year long. Number 2 is about creating the biggest net. If you're going fishing and I'm gonna say you're a commercial fisherman, you're using a net to fish, right? You want the biggest net. If the ocean was full of fish, just full of it, and you're putting the net in, you can only grab as much as you can grab in that one net, right? And so creating a bigger net is different for everybody in different phases. In the beginning, it's sharpening your skill set so that you can help as many people as possible. It is setting the expectation with your friends and family that during AEP, you're going to be committed heavily to that occupation or that enrollment period to get as much going as possible, right? It's clearing the deck or clearing the plate from all of the unnecessary service work or prospecting that needs to be done so that you can have this huge net of time, because the time is the net, to pull in the actual sales that you're setting out to do. So, as you scale and you're bigger, it's about having more trained people. It's about having a bigger net by having more people to help you capture those sales, right? So number 3 is kind of right along the lines with that, right? So if I'm trying to have a bigger net, I said one of the things you can do is try to help as many people as possible. So number 3 is increase your knowledge so that you can help a multitude of people or people in a multitude of different situations, whether it's a Medigap to Medigap rewrite and you're having to learn underwriting, whether it's Medicare Advantage special enrollment period navigation, whether it is, just different PDP writing. And it really helps too for us when you're focusing on one geographic area, because you can become so familiar with the plans. It gets to the point where a lot of the answers to intricate situations you already know the answer to, and so you're not having to waste a ton of time looking that up. Like, oh, you only use one doctor and that's Phil Jones. Okay, well, I know Phil Jones is in this network because I've already looked him up 5 times. That's going to save me a lot of time of having to look up somebody every single time when I already know Phil Jones is in the network because I've looked him up 2 or 3 times. When you're doing all 50 states and you're doing it over the phone, that can be a lot more difficult to get there. But, in that case, technology is your best friend. So make sure you have the smoothest technology and you're very familiar with it before you get into writing applications during AEP. So increase that knowledge, get in the virtual room or actual room with more agents communicating so that you can learn from one another and crowdfund that information into your head so that you can help as many people as possible in that confined amount of time. Number 4 is cross-sell. We talk a lot about cross-selling. There's some tips that we always talk about with cross-selling on how to do it. We've put together our bundling Blitz course in the past, which is in our Go Guru University. But that bundling course is something that's been huge for people on how to organize the conversation to effectively explain the necessity of each product and get the client to choose having more products than just the baseline. There's an art to that conversation, and if you set it up inappropriately, or not inappropriately, but inaccurately, or not in the right manner, you're going to have more people, unfortunately, picking the base coverage because of the way you organize the conversation. You can give the same information in the wrong order, and boom, you have people choosing the cheap way out, right? Because you've psychologically set them up for that. But cross-selling is a huge opportunity for you, not just during AEP, but all year long. And that cross-selling will get you more referrals too. So if I'm going to cross-sell dental, let's say I'm cross-selling dental to a Medicare supplement client or a Medicare Advantage client, and I wrote that standalone dental plan, it could be the dental plan that gets me the referral later on. For instance, so-and-so may be saying, well, I don't have any dental insurance. And then, Jane Smith, who we helped get a Medicare supplement, a drug plan, and dental insurance, tells them, oh, I got my dental insurance with Justin Brock. Okay, well, now that person comes to you for dental insurance, but you may be able to help them with their Medicare supplement, Medicare Advantage plan, all those types of things. So, the more that you can place there, not only is the business stickier, the more products you have in one household, but it gets you more referrals. So if all year long you're cross-selling well, you're going to have more referrals for AEP. If during AEP you're cross-selling, then it's just going to get you more applications, but it's going to get you more immediate cross-sells and income right then. Also, when you're in AEP, especially if you're writing Medicare Advantage, you're likely not getting paid on a lot of that business until the first quarter of the following year. So those cross-sells can help keep the lights on, so to speak, especially before you have your renewal income built up in that time. Hospital indemnity and cancer help our agents get paid quite a bit more during AEP, and those are sales that somebody else will come along later on and sell your client, or even use the fact that you didn't sell it to replace your Medicare Advantage plan or Medicare supplement plan. So definitely look out for that. Cross-selling is a huge part of what we do and our success. Number 5 is ask for referrals. We just talked about ways to get more referrals in cross-selling. I wholeheartedly believe that cross-selling does lead to more referrals naturally, but you need to be asking for the referrals. If you're sitting there with someone who just trusted you to change their entire healthcare scenario, it's likely that you can get them to refer you someone, and then that transfers the trust that they had in you to this new person. A referral is the best kind of lead, so why do people not ask for them enough? Unfortunately, we just see that people don't ask for them because by the time somebody buys from them, it's this euphoric high, and they just kind of close, with, oh, great, that's wonderful, and they're trying to get out of the house, or they're trying to get off the phone as soon as possible. That is a best time to be asking for the referral actively. And it's as simple as, hey, listen, I'm not going to ask you for a list of everybody you know, but surely you know somebody who's in a similar situation to you. Do you know 1, 2, maybe 3 people who are in a similar situation that I might be able to help? Then if you get that name and number and it's John Smith, and you call John Smith and you say, hey, John, Jane told me to give you a call, said that you might be in a similar situation to her. We just actually helped her save some money or pick out this coverage that met her needs. And she said that you were probably in a similar situation. So what Medicare coverage do you have right now? Boom. That's how you do it. And that's how most of them, some of them are even better than that. Sometimes you get somebody that literally calls them up and gets them to come over to the house and talk to you on the phone right then. But most of the time, it's just about getting that name and number, calling, transferring the trust from Jane to John, and closing more deals. Also, this slide's a little funky looking, but bonus tips. I know I said 5 steps, but as I was making the 5 steps, I wanted some bonus tips. It might turn into 8 steps, but bonus tip number 1 is make sure that your carrier certifications and your AHIP or the NAHU certification, if you choose to use that one, are completed by the end of August. That's the deadline we try to set for all of our agents. You need to complete it by the end of August. You do not need to be going into pre-AEP having to complete carrier certifications, because that being on your mind is going to stress your mind out, and you only have so much capacity in your brain to operate. You don't want to be doing that then. Do that in August. Do that in July. But definitely by the end of August, AHIP and all carrier certifications should be completed. Bonus tip number 2 is go to your carrier rollout meetings for areas you work and network. And when I say for areas that you work, if they have a rollout meeting for United Healthcare, Humana, any carrier meeting, go to it, network with the other agents there, network with the broker managers. Those broker managers can refer you business. Those broker managers can help you out of problems. You can get their cell phone numbers and text them for quick information that can save you a lot of time and help you close more deals. And network with all the other agents there, because it's likely that some of those agents are newer. Maybe they'll latch on to you, and you can help them through some things. You can split some cases together. Sometimes they'll come up with other opportunities. Networking with other agents has always proven to be a successful utilization of my time. And I think that sometimes agents back in the day thought that they didn't want to share anything with other agents because they were, competition. But if you don't think that way and you just go out and network, you'll find the majority of them you can benefit from, or at least somebody out there knows what you're talking about in your local area when you talk to those local agents. So definitely spend the time going out there, and you're bound to learn something if you open your ears at one of those carrier meetings that helps you close more deals. And the last bonus tip, go here, is spend time building referral partners during the lockout period. So lockout period is not quite as bad as it used to be, because we have tons and tons of special enrollment periods, but it certainly slows down because the buyer behavior is not there the way it is during AEP. So spend a lot of your time during that period building those referral partners, because if you build referral partners with P&C agencies, if you build referral partners with financial advisors, doctors' offices, all these groups, pharmacy techs, pharmacists, all these groups are going to be getting asked about drug plans, Medicare Advantage changes, Medicare during AEP. And if you've built that relationship during AEP, you're going to get those referrals. And those are often lay down sales. Okay, lay down sales. Now, even if it's drug plans lead to med subs. Drug plans lead to cross sales. Drug plans lead to all sorts of things. So you want those referrals because they've already transferred the trust. If they'll trust you with a drug plan, they'll trust you with your Medicare supplement. Sometimes the drug plan is attached to a Medicare Advantage plan, and so you're actually getting a Medicare Advantage sale. So build referral partners during the lockout period is very, very important. Now, at this point, normally in a presentation, I would ask you all if you had questions. So what I'd like for you to do is submit those questions to me any way you can. If you're watching this in a capacity where you can ask them to me directly, go ahead and do so. If you are not, then please, by all means, go on our YouTube channel and submit these questions as comments on any of our content. If this is on YouTube, or if this is on some sort of platform that you can ask the questions in, put them there now. If it's not, and you have someone who's sharing this to you through your hierarchy, then please let them know what questions you have. I would love to answer them. Thank you all for taking the time to watch this, and I hope that you have a kick-ass AEP. It's time to grow your agency like a guru. Introducing Go Guru Pro. The Go High Level platform allows for minimizing software-based subscriptions and grants control over several facets of marketing and communication. Automate your workflow, communicate with your leads, book appointments in advance, and house all your clients in one secure location. Visit goguru.pro and schedule your one-on-one demo today.